Hello, my name is Johnny from Baylor St. Luke's Medical Center. This is a training video on the new male Purewick urinary catheter system. First, I'm going to start with hand hygiene. Put on my gloves. Next, you will collect your Purewick and open the bag. You'll tear the side here. Pull out the device. In the bag, you have the Purewick itself. There's also a perennial care cleaning wipe and a towelette to dry. I can get it out. First, I want to go over some important features of the bag itself. This is the front of the bag. You can tell by these vent holes right here. There's 1, 2, 3. On the back, you have a flap here with adhesive on it and an opening for the male anatomy to go into. Now this device is going to be for your patients that do not have the proper anatomy conducive to the current condom catheters that we're using. For example, if the patient is swollen or the anatomy is too small and you can't get a condom catheter in place, or the condom catheter keeps popping off, this is going to be a good alternative to use for that. Next, you'll notice that we have a trimmer. This is going to be vital for this specific device because the most important thing is to have a good seal around the patient. Otherwise, this is not going to work because here, this is where we're going to set this up to suction. So first, we need to trim our patient. Over here, we're going to trim any excessive hair off the patient and make sure you have a smooth surface for this to seal. After that, you will open up your cleaning wipe, and you may need to brush any of that hair off while it's dry, otherwise it's just gonna stick. And then you can use the wipe to get rid of any excess oils, any hair that's still left over on the patient's skin. And the device is gonna sit around the penis and the scrotum. So you're cleaning everything around that so that it can stick. Next, you're gonna grab that towel and gently dry. Okay. Then we'll get our pouch. At this point, you can hook it up to suction and test it and make sure it works. You'll turn the suction to about 40, sometimes 60 millimeters of mercury, and you'll be able to see if there's any open holes or anything in the bag that might make you want to go grab a new one. But in this case, we're just going to go ahead and turn it over, peel off the cover around the adhesive here on this flap. Okay. I'm going to pop it off for the video to make this easier. And then in most cases, you won't have this anatomy, but it should slide over the penis and seal. So you'll just stick it like so. And make sure you press all the way around, forming a seal underneath, because when you hook this to suction, any of that air that escapes is going to cause an issue. So now that we have a good seal, and if it's not already, you can hook your suction tubing back on. And once again, you want to make sure that when you cover this patient up, you're not causing any obstruction to these vent holes on the top of the bag. You can put a light sheet over them. They all work together, but if all 3 of these are getting blocked, you can get urine to back up in the back here. And then another common issue is the end of this patient might lay on it. The tubing could become blocked. So you want to make sure that your flow here is unobstructed and this isn't folded under like this. Last thing to note is this should stay in place for 24 hours. After that, you just replace the bag altogether and you'll get new tubing and you're good to go. Thank you for watching.